don't know if you can see me, but I'm going to explain diabetes to you, type 1 and type 2. So just the pathophysiology and just a little bit about treatment. Um, okay, so you have type 1 and type 2. So type 1 is an autoimmune disease. Um, Autoimmune means the body attacks itself. So as if my white blood cells attacked my own organs. The body makes antibodies, in this case the lymphocytes, and they attack the beta cells of the pancreas. Beta cells, their role is to make insulin. So if you don't have beta cells, functioning beta cells in your pancreas, you can't make insulin. So the lymphocytes go and attack these beta cells in the pancreas, and then the pancreas is unable to make insulin, which makes it so you have a deficient amount of insulin circulating in your blood. The role of insulin is extremely important because if you don't understand the role of insulin, then diabetes will just not make sense to you. So I'm going to quickly go over that before I get to the more complicated type 2 diabetes. So insulin acts as like a key to get into the cellular membrane. So here's a cell, and inside the cell you have like the mitochondria, the Golgi apparatus, the nucleus, which holds the DNA, and we all know all that. But the cell also has a cellular membrane, and on the cellular membrane there's these little things that look kind of like keyholes. And in order for something like glucose, which can't just freely pass through the cellular membrane, needs this keyhole to be opened for them so that they can get into the cellular membrane. Glucose is extremely important because glucose is the number one source of energy. So when you eat, the food gets broken down, the carbohydrates get broken down into glucose, and the body absorbs the glucose and gives it to its cells for energy. If you don't have enough glucose and you're just a regular person, no diabetes, your body uses all that glucose energy and then starts to take from the muscle cells for the energy that it needs to make more glucose through glucogenesis, and then from there it takes from the fats. So if your body can't get the glucose into the cell, then the cells don't have the energy it needs to function, and then that can cause tissue damage, like how diabetes patients tend to have neuropathy. It's because of the damage to the cells. Also, reasons why they have poor healing is because they have poor perfusion, and that just is very complicated, but I'm just here to teach you about the pathophysiology. Okay, so you have these little glucose stars floating around in your blood, and if you don't have insulin, it has no way of passing through to the cellular membrane. So if you have type 1 diabetes, you're insulin dependent because your body can't make insulin, so you have to inject yourself with insulin, and then that way your body then has insulin to open up the cellular membrane for the glucose to pass. Type 2 diabetes is a lot more complicated. There's 3 different types of type 2 diabetes. I like to say different types because it's easier to understand in that way than thinking that all 3 of these are happening to one patient at a time. Each patient can have a different type of type 2 diabetes. So the different types, they have resistance, so insulin resistance, that's at the cellular level. Inadequate production, that's at the pancreas. And then glucose intolerance, and that has to do with hyperglycemia, and then the body continues to use glucogenesis to make more to make more glucose. So I'll go into each one at a time. So to start, we'll talk about insulin resistance. So like I said about type 1, you need to have the insulin to open up the door to get into the cellular membrane. So we have club cell here as a good way of explaining diabetes. And the bouncer is the cellular membrane. So the only way to get into the club is to get through the bouncer, right? So you have to make sure the bouncer likes you, you have to bring your ID or whatever to get into the club. And you have one friend here, he's older, he's like 21 or up, and he's trying to get you, your friend who's like 20, into the club. And he's like, good friends with the bouncer, so he like makes like his comments and he like does his thing, and the bouncer lets you into the club. So that's with insulin. So your best friend who's 21 or older is insulin, your glucose, the bouncer, is cellular membrane. For insulin resistance, that would be as if your friend wasn't close with the bouncer and you were trying to get in the club and he just couldn't like sweet talk you in, so you didn't get to go to the club. The cell doesn't respond to the insulin in the same way that it would in a healthier person. So you still have the insulin, it's just the cellular membrane keyhole changed in a way that it doesn't respond to the insulin in the correct manner. So your body will continue to make insulin and you will continue to have hyperglycemia because because the insulin doesn't work with the cellular membrane and doesn't let the glucose pass through. So that's insulin resistance. For inadequate production, for some reason, the beta cells of a type 2 diabetes patient does not excrete enough insulin. So they make insulin on their own, they just don't make enough to transfer all the sugars into the cells. So not like how type 1, the body attacks itself. I couldn't find anything on Lippincott as to why the cells stop producing enough insulin, but they don't produce enough. So like let's say you have 50 kids you have to feed, but you just have enough to feed 30. Like that's not enough food. So your pancreas is not excreting enough insulin to cope with the amount of glucose in your cell. It probably has something to do with the negative feedback loop, but I don't have that set in stone in my notes, so I'm not gonna like tell you to follow that. Just know that the pancreas is not producing enough insulin to get all the glucose in the blood into the cells, which means that the cells aren't all getting enough energy, enough glucose, so you're of course going to have the hyperglycemic, the hypoglycemic effects depending on the situation, right? For glucose intolerance, so that's if you have a hyperglycemia, but the body continues to make glucose. So your body can't just make glucose. The glucose in the simplest form that you get is from eating carbohydrates and your body breaking it down through the GI system. The only way the body can make glucose is through the liver making it. So yeah, one of the liver functions is metabolizing sugar, and it can also, that's through glucogenesis. So metabolizing glucose would be the glucogenesis cycle, which takes some of the muscle cells, breaks it down, and turns it into glucose. And that's here the arrow, you can see glucogenesis in the liver, and then it makes glucose. And so that will increase your glucose in your blood, your serum glucose, even though you have a high amount of sugar or glucose in your blood. So regardless if the patient is hyperglycemic, the body will continue to make more glucose using the muscle tissues. So that's pretty much that. The important part to remember is that insulin is the keyhole to get the glucose in. And then the pancreas is not producing enough insulin to get enough glucose into the cells, and then glucose intolerance, the body continues to make glucose even though you have enough glucose in your blood. And for treatments for type 2, so if you have insulin resistance at the cellular level, you give them metformin. So metformin helps with the insulin resistance and helps more the insulin respond. It's kind of like another type of keyhole. It kind of fits inside the same keyhole. It's not the exact same thing as insulin, but it looks slightly different, has the same shape as the insulin's keyhole or key, and fits into the hole, opens the door for the glucose to go into the cell, and then that is how metformin works. So metformin is like a fake key, like someone pickpocketing you, or not pickpocketing, you know when they go in the keys and they like do the thing with the bobby pins? That's what metformin is. It like pretends to be a key, opens the glucose door, let the glucose into the cell, and then gives the cell the nutrients it needs. For production, so inadequate production of insulin, you just give insulin. So patients who aren't making enough insulin, you give them insulin because their pancreas isn't able to make enough for the amount of sugar in their blood. So if you give them more insulin, then it will allow the insulin to get into their cells. And then glucose intolerance, you give metformin. There's lots of different types of insulin. I would recommend going over it. Um, just remember that type 2 is not autoimmune. So you can get that from like an unhealthy diet, a sedentary lifestyle, and pretty much just like not living a healthy life. A lot of people get type 2 diabetes. It's really common in Hawaii. Type 1, you're born with it, it's genetic. Um, you're on insulin for the rest of your life with type 1. So, another person to remember if you have a hard time, but if you know Nick Jonas is a type 1 diabetic patient. He has to give himself injections with every meal. So, if you're type 1, if you have a type 1 diabetes patient, they have to give themselves insulin with each meal because their body doesn't produce insulin to use that glucose that they get when they eat. If they're sick, any diabetes patient, if they're sick, they need to test their blood sugar a lot more because we all know when you're sick, the cells are working a lot harder to, you know, get better. And if they need more, if they're working harder, you need more energy. So, in a way to remember that is if you're working out, you're not going to eat less. If you're working out every single day, you're going to eat more because your body needs more energy. So, if you have a patient who's sick and has diabetes, you're always going to make sure that, you know, you test their blood sugar, make sure they have, you know, you give them insulin if they need to or their medication because the body's working really hard to get them better and they need that insulin to help get the glucose into the cell. Go over the insulins and the different types. Definitely go over the hypoglycemic signs and symptoms and hyperglycemic. So hyperglycemic, that's when there's a lot of glucose in the blood. A lot of glucose in the blood, not a lot of glucose in the cell. Hypoglycemic, they can have zero glucose in the blood and have zero glucose in the cell. So you're going to have to give them orange juice, hard candy to suck on, tablespoon of honey. There's all kinds of different things. Give them the glucose tablets. But you just have to know how to treat that. But I'm just here to tell you the pathophysiology. So that's pretty much it. Yeah. So if you have any questions, I mean, you have my number or you know where I am. I'm at school all the time. So just let me know. So insulin's your buddy. He'll get you into the club. So hit him up.